I was here when we celebrated the 25th, and I was here when we broke the ground for this building. I was here when we got the graduate program. When I got the notice from Nancy that we're going to have 60 years since I first graduated, I thought, oh my God, I can't believe it's so fast, We've done so much.
It doesn't seem like it could possibly be that long. Although I have to admit I'm older than the school is at this point, but that's a remarkable feat.
Really and truly, I thought, it's only been 60 years.
Congratulations, Idaho State, on 60 years of an excellent nursing program, and I'm very proud to be a graduate.
I really believe Idaho State's the leader in health professions, and nursing is just a fundamental component of that.
I think it's wonderful where they're going now. I'm really proud of the fact that the current faculty has got a doctorate program going.
Well, it was a time in my life when I was ready to select a PhD program, and I saw that Idaho State University had just opened up applications. And then I went to look to see, gosh, what's the school about? And what I really enjoyed was their vision to be the internationally renowned school that attracted individuals that were committed to excellence in the areas of research and education.
I came in 1965 and I graduated in 1969. I was so focused, you cannot believe it.
The choices were few in the 50s. You could be a teacher, no way, a secretary, not inside, and nursing. And I had planned on it, played nurse all the time I was growing up. So I decided to be a real one.
I had the opportunity to go with my mother to work one day and see what she did in the office setting, and visiting my mom at work and my aunts at work. And I loved healthcare. I loved the patient experience, and I loved taking care of people.
I've always been somebody who really cares about people, and going through this program, it has really solidified in me that I do love people and I do love taking care of them.
I didn't realize how protected my life was growing up until I went into nursing, and then I saw people from all walks of life, and that was kind of a real eye-opener to me about how many advantages I had in my life compared to some people who didn't. And that's why I wanted to be a nurse, so I could make a difference.
I'm remembering when I started in the nursing program, we were located in, I think, what is now the dental hygiene complex. It's a small, old facility on that campus. We shared that little tiny building with dental hygiene. I remember practically sitting on each other's laps in the classrooms. It was just so small.
And one of the first committees I was on was a committee to write a grant to build this building back in 1966. And we had to write a grant, and so I was a student rep for that committee. And Helen Beckley was the chairperson, and she worked so hard to get this building.
We moved from that very small space up to the current nursing complex, which was modern and big and sprawling and very, at the time, high-tech. We just thought we had moved into heaven, probably. But I think what I remember most is that we were a very tight-knit group.
We had a great group. In fact, I was reminiscing looking at my class picture out here. We had a lot of fun times, but we all helped and supported each other through school. But we made it through school because of the great teachers.
Throughout the nursing program, my professors were very mindful of imparting a culture of critical thinking in us.
It's a program that has dedicated faculty. They strive to develop their students to be the best they can be.
The nursing program itself provides you the foundations, and I think you can't build any good home, any good business, anything without a solid foundation.
This program helped reiterate and reinforce where to go for the evidence, where to look for the research, where to look for those people that you can collaborate with.
And that was what I really valued as being a student, was not everything that I was asked to do was in a book somewhere that I could go find. It was like, I get to be a scientist. I get to try to discover things, and that was fun for me.
We started with 18 in my class. We graduated 6. When it came time for state boards, we all felt we were prepared. And all 6 of us passed our boards with flying colors.
The nursing program helped me prepare to become a nurse practitioner through really testing your commitment. Because if you go in and don't really know, is this the career for me? Is this what I should be doing? It's really easy to walk away from it. When things get hard, and it's going to get hard, it's easy to just say, I'm done. And so I think that it tests your commitment. Do you really want to do this? Are you really invested?
It made me very, very globally aware of things going on, that nursing wasn't just in Pocatello, Idaho. Nursing was all over, universal.
I went by myself to Boston, Massachusetts. I interviewed for a position over the phone, was offered the position if I passed my licensing exams and got a license, which I did. Got on a plane, flew to Boston, and my first job then was at the Peter Bent Brigham Hospital in Boston, working on a male surgical floor with a neurosurgical specialty. I was just scared to death, I have to tell you.
There are instances where I have really made a huge difference in my patient's life.
I can look back in my direct clinical work inside the operating room, and I actually was part of saving people's lives inside that had a major trauma.
And we waited one evening for a fellow physician to fly in from Salt Lake City. At that time there was a landing strip right across from Bannock Hospital. He came in and we put in the first pacemaker that was done in Pocatello. And I got to scrub on that.
Multi-trauma, 2 surgeons working at the same time on the patient, and me as a very confident nurse is when I realized this is really for me.
Well, there was a patient that I took care of that was really struggling with his mental illness, and he was in a hospital, and he just got out of the hospital, and I became his home health nurse. He was really struggling with mental illness, and by taking care of him in the next 4 months, I was able to prevent him from going back to hospital. And at the end of that 4 months, he really was able to tell me that you really saved my life.
We had rules about families coming in to visit with patients on the night prior to open heart surgery. And patients' families were not allowed to come in after 10 o'clock at night to prepare the patient for surgery the next day. This family came to me and very concerned about her husband and their father, and really needed to see him before he went to surgery. Being the nurse that I am, said, we'll work this out. So I want you to show up at 4 o'clock in the morning. I'll arrange for you to come in the back of the unit. You can visit with him and spend time with him, but then you need to quickly leave. You have about 20 minutes. And so I arranged for that family to come in. So when I came the next day, I was told that the family did make the trip. They came in to visit with their husband, with their father. They spent quality time with him for about 20 minutes. I can't tell you how grateful I am for doing that, because he went to surgery and he did not survive through surgery. He didn't make it through surgery, and it was devastating. He was one of these candidates that we thought he'll sail through surgery, he'll do great. And unfortunately, he's one of those individuals that had massive complications and he didn't survive. That night, I got a call from that wife thanking me for making a difference in their lives. And the next day, even with all the things they had going on in their family, they showed up at the hospital and brought me a little bouquet of flowers and a little handkerchief with my initials on it. And I can't tell you the impact that had on my life, that I made a difference in their lives by doing what I felt like was the right thing to do.
And every so often you'll get a note or a thank you, especially now that I'm doing labor and delivery. And those are moments where it's either the best day of their life or it's the worst day of their life. Labor and delivery isn't all laughs and smiles. Sometimes it's heartbreak. And I think that those are the moments that's when I go home and I really feel like this matters.
How would you describe how quality nursing programs impact people's lives?
Well, there's no more important work than what nurses do. They're with people at the most important and sensitive times of their lives: the birth of a child, death, serious illness, as well as helping people stay healthy. So nursing is a very, very broad field that touches human lives in all respects.
What I was able to realize through this nursing school and the program was that nurses are leaders every single day. Nurses are leaders in the society, leaders in the community, as well as leaders in the profession that they are. Year after year, nurses are the #1 trusted profession in this country.
You know, now today I'm in the hiring position of all those people. And I always know when I come and I look at a resume and it says Idaho State on it, well, there's one, a lot of sense of pride because I graduated from that program, but two, I know that their education is really well done and that they've put in the time, there's motivation, and that those people have the skill set that I need in order to make my hospital better.
One of the ways that I judge the quality of our nursing program is the employability of our graduates. I know that there are many hospital administrators that I interact with on a daily basis who always put ISU grads at the top of their list of new employees. So that indicates to me that we're producing a very high quality. I'm proud of the faculty who have done that. It's all because of them.